Oh, you were full on MMJ.
Full solo.
Mm-hmm.
I was not the least bit surprised.
Right?
Also, I should have probably.
But it went well though. I caught it on it.
I thought for the first one as well. That was also fun. I should have put two and two together, but I asked that. I was just like, so where am I in the show? They're like, you're leading.
You're top story.
Okay. Look at the jerk you've seen the vine before. It was like the hi.
Yeah.
Okay.
Yes.
That was
you?
Okay.
Oh, that's good. What was I going to say? Yeah, we definitely should try and golf before it gets cold. Because the more bad people I play with, the better I look. So. And I'm very bad.
I beat him. I had a horrible last two holes. I went +9 on my last two holes, and I still beat Carter.
What was your final score?
It was like 60. 9.
And then, wait, okay. So then, in total?
No, it's
for 18 holes?
Mississippi's not.
Oh, it is? I never played there. That's why.
Yeah, just 63 or 9.
Okay.
It's my last two holes, like I said, +9. So if I would have just normal, like double bogey, I would have been under 60.
Right.
So is it good?
No.
Good.
But, you know, in our standards, yes, it is.
It's like, forget that. Well, I mean, my first 3 holes were abysmal, my last 2 holes were abysmal, but no,
Or abysmal.
there's some good golfing.
Good golfing then.
Bogeys on bogeys.
I took a week off a couple weeks ago. My dad and I went up to Culver, Wisconsin, up near Sheboygan, went on the Black Wolf Run.
Oh, yeah.
And we had lunch at Whistling Straits. Holy crap, is that beautiful. But my dad had the luckiest run of his life. He shot 79, and he birdied in on the last hole from 80 yards out. I should have been filming. It was so good.
They're doing 2 thumbs up for us. We're ready.
I just did 2 thumbs up. Don't put that into that.
Yeah, we're. Hey, listen. It's okay.
Good afternoon. I'm Dr. Sandra Martown, the Public Health Administrator for Winnebago County, and I'm joined today by Mayor Thomas McNamara of the City of Rockford. So today is August 31st, which is recognized as throughout the world as International Overdose Awareness Day. The goal is to raise awareness of overdose and reduce the stigma of drug-related deaths. So while we've been talking about COVID-related deaths and what other associated, conditions are with COVID, today we're going to talk a little bit about this stigma of drug-related deaths. And our goal today is to remove that, to understand it's a medical cause, just like COVID-19 is a medical cause. Despite a global pandemic, deaths from overdose have continued both nationally and here locally. In Winnebago County in 2019, there were 130 overdose deaths. From 2020, from January through July 31st, so first 7 months, there have been 117 overdose deaths. So what can you do? Remember I said part of it is to gain awareness. So what can the public do? We can get trained to administer Narcan or naloxone, which is the life-saving drug. The training can be provided virtually or in small groups with appropriate social distancing and face coverings. While you need access to the nose of an individual who has overdosed, you can wear your face covering and mask and administer the naloxone and Narcan and sanitize your hands afterward. The time it takes to administer is less than 15 minutes. So the risk to you as a bystander assisting with a rescue is minimal. Anyone can save a life, and we need everyone to be ready to save a life. Every home should have naloxone, and every community member should be trained to administer. So for information on training, please see our website or contact 815-720-4283. We need everyone to be trained to save a life. Last week, we heard about updated testing guidelines for COVID-19. Both the Illinois Department of Public Health and the Winnebago County Health Department, along with its Northern Illinois Public Health Consortium partners, came out strongly to encourage testing for individuals with symptoms of COVID-19 individuals who had close contact with someone confirmed with COVID-19, individuals who have been referred for testing by their healthcare provider, individuals who require screening for congregate settings, including our universities that are returning, individuals who may have been exposed in a group or crowded setting or travel to an area with higher rates of infection. In short, we recommend testing of everyone. Testing of asymptomatic individuals helps us to identify infections of COVID-19 in individuals earlier to prevent community transmission. And our community has understood this from the start. All community-based testing sites in Illinois, including the sites in Winnebago County, at the University of Illinois Health Sciences campus, and the community-based testing site at Rockton Avenue, formerly Schnucks, are open to all regardless of symptoms. Individuals who test should quarantine until their results are received. And I'm often asked this question, if you're a contact to a case, will a test get you out of quarantine? You cannot test your way out of quarantine if you've been exposed to COVID-19 and have been called and asked to get tested. So I've often heard about, well, if we test more, our metrics get worse. And so again, our metrics focus both on new infections and the percent positivity in the community. So simply getting more testing doesn't increase our chances of having to implement stronger mitigation standards. Testing is not a numbers game. It is intended to prevent additional infections and especially protect our vulnerable individuals in the community. So we approach our third holiday season of the summer, which is Labor Day gatherings and celebrations. I want to remind the public as well that family gatherings are becoming another major source of transmission of COVID-19. Spikes of COVID-19 were related to Memorial Day holiday, the beginning of the summer, our July 4th celebrations throughout the states, including California, Nevada, New York, North Carolina, Utah, Texas, and others. But we have to come back and say, what were the origins of Labor Day? It's rooted in the trade union and labor movements that sought to improve the working conditions of Americans. And we've all begun to understand how important essential workers and our entire first responder workforce, our healthcare workers, and as we begin to return to our schools, our teachers and the staff that support our schools. We need to be mindful and intentional about celebrations and long weekend plans. We want to limit the number of contacts and potential exposures, wear face coverings, maintain social distancing, and wash your hands. Nothing new, but I'm going to add a little twist one. Keep it local. We know our infection rates in this area, and we know we've been working hard to keep it low. Let's honor all the workers in our community by wearing our face coverings when we're in their presence. Let's protect them, their families, and the work that they do. If we want to continue our restoration and our rebounding, we need all of our workers healthy and able to carry on. Local numbers. Today, there were 9 new cases reported for our total case count of 4,233. As expected, at the end of last week, we turned orange based on the case rate exceeding 50 per 100,000 for the week ending August 22nd. Our case rate for Winnebago was 66 per 100,000. Our rolling positivity rate is under 5 at 4.6%, but while we're still under 5%, we've had positivity rates of 8% or higher in the last week of August. So we expect that we will be going into orange in that area as well at the end of this week. The highest infection rate continues to be among our 20 to 29-year-olds. So understand how important that group is to keeping our rates down. And when I talked about testing earlier, about the importance of everyone getting a test, approximately 22% of our population has sought out testing. Total tests performed to date in Winnebago County are over 65,000. We have no additional deaths to report, and our recovery rate is at 96%. We have no new locations of concern. But as we prepare after Labor Day to return to in-person education and hoping to support that option, we need to continue to be vigilant by wearing our face coverings when it's outside of our home, washing our hands frequently, maintaining social distancing, cleaning frequently touched surfaces, and staying home when sick. As I've said before, these are easy things to do, and we've got this. If we want to keep our infection rates low, and we want to continue on our restoration and recovery process, these are the activities that we need to do. So thank you. I'm going to turn it over next to the mayor.
Thank you, Dr. Martell. I remember the first couple of weeks we were talking about getting up to 2,000 or 3,000 people tested, and just to see the phenomenal work that you and your team, as well as our community partners, have done to enhance testing is really phenomenal. So thank you. We've worked now with the health department for a number of months to talk to you and educate you about different ways that we can help stop the spread of COVID-19. We're continuing to do important work here at the health department and throughout the entire city and county. And I say this at every single briefing that we've had. Now is the time to continue to be vigilant. We know right now that through COVID-19, not only the virus, but also the mitigation efforts that had to take place to help slow the spread has had a tremendous impact on every single person's life in our community. Business owners have arguably been some of the hardest hit in their everyday life. They've taken some of the hardest hits of the economic impact of COVID-19, and our Community and Economic Development Department has worked diligently since we first heard of the virus to think of different ways that we can assist businesses. We've provided 0% loans, and we just announced this yesterday to those businesses. We just provided 25 micro enterprises, so that's businesses that are 0 to 5 employees with 0 interest loans. And these micro enterprises, these are really what make up the fabric of our city. These are small businesses embedded into our neighborhoods who employ our friends and family members, and those who often do not have the resources to get state and federal assistance. Of those businesses, 72% of them were minority-owned businesses that we assisted. These loans have helped these small businesses stay afloat through the economic downturn caused by this pandemic. We're just this evening reading in yet another new program to enhance our efforts to help small businesses, so that'll be read in this evening, to which we want to help more small micro enterprises throughout our community to help them stay afloat during these really difficult times. We're also helping residents during these tough times. We're obviously seeing a higher unemployment rate than anyone would like to see during this global pandemic. And we just opened up a minor rehab housing lottery program where if you have small house repairs, some even larger house repairs, anywhere from $2,000 to $25,000, we may have a program for you. And you can utilize these funds to help you with electrical, mechanical, exterior, plumbing, and even accessibility modifications that you need to have done at your home. These are for single homeowner occupied residents in the city of Rockford, and we're going to be closing the application deadline on September 9th. If you want to know more about these programs and if you would be able to take advantage of this program, please call 779-348-7162, or you can email N as in Nancy, D as in David, housing@rockfordil.gov. So as we continue to move through this global pandemic, and we've seen, as Dr. Martell said, that positivity rate tick up just a touch, please remain vigilant. We know what we can do. We've said it now for months and months to you. So please, I know those watching this know what to do, but do us a favor. Tell your friends. Tell them to wear a face covering. Tell them to wash their hands regularly. Tell them to practice social distancing. Tell them over the Labor Day weekend when they have events, take them outdoors. You can still gather with your family, but you have to take them outdoors, and you have to take every precaution that you possibly can to help slow the spread in our community. We've worked too hard to get to where we're at to let it slide back after a holiday. Last thing I'll mention is we are now 31 days away from the deadline for the census. The census is critical to our community. For every single individual who completes the census, we receive as a community about $1,560 per year per person. So one person fills out the census over a 10-year period, we get $15,560 that can make a tremendous impact in our community. Those areas that are hardest hit are the same areas that we've seen are the hardest hit by COVID-19. So please, if you have not done so, take the 5 or 6 minutes to complete the census. You can, it's absolutely vital to our community, and you can complete the census by going to my2020census.gov. That's my2020census.gov, or call 844-330-2020. And we'll open up for questions.
Mayor, can I clarify on the loans? You said there was 25 actually closed already, or?
No, for the micro business loans?
Yeah.
Yes, we've already completed and announced 25 businesses that have received the micro enterprise relief loans.
Do you know the range of those loans? Like,
I don't have that information with me. I can get that for you today.
and are there limits on how it
Gotta
can be
read.
used?
So the question, sorry, I'm not repeating any of the questions. You would think after 6 months of doing this I would learn, but I'm slow. So I would say, first question was, were those 25 loans that were closed? Yes, we have approved 25 loans for micro enterprises, which are businesses 0 to 5. I will get you the amount that they've used them for, the amount that we've provided to each business, as well as a list of those businesses. I just announced them yesterday in a video, and we'll get you exactly what they were used for.
Additionally, when it comes to the city, we're talking budget tonight at City Council.
Yeah.
And there's some good news when it comes to what we're looking at for the deficit of 2020 when it comes to COVID-19. Can you kind of go through that a little bit for us?
So the question was, we are talking about the City of Rockford budget tonight, and question stated that there was some good news when we look at the deficit that the city's facing. I certainly understand the question and appreciate it. Good news and deficits usually don't go hand in hand, but I understand the question. So we were projecting a significant deficit based on Illinois Municipal League's projections that they provided to all municipalities. We have been fortunate in 2 areas. One, we have outpaced some of those projections, and 2, we worked really hard, myself, Chief Bergson over at the Rockford Fire Department, to advocate to get ground emergency management transportation dollars to our community, which has brought us an additional around $6 million to our city. And it's really has been a tremendous amount of relief to our city budget as we were able to secure those dollars. So there are some silver linings in that dark cloud of deficits, but we certainly still have a lot of work to do.
Dr. Martel, just to go back about today being Overdose Awareness Day, we've reached out to a few drug addiction facilities, and they tell us more people are using drugs to cope with the stress due to the pandemic. What is the health department doing to combat this?
So the question is, as we move through the pandemic, we know that mental health has been a significant issue, and there's increased substance use going at this time as a coping mechanism. Well, we have focused throughout this at various times and intervals to make sure that people were aware of the resources available to them in terms of mental health support and guidance. And which is why when you think some of this interconnectedness, when we talk about bringing the schools back, when we begin to bring people back to their businesses, when we start talking about this rebounding, is to put some routine and normalcy back into our routines that are not really there today. Right, so if we can get our children back in school, then more people might be able to return to work. Some of the stresses of being in quarantine with family members and close quarters, we can begin that kind of process of gradually rolling out. We are constantly making referrals. Part of the contact tracing team is to have that discussion with individuals and ask them if they need referrals and resources. As we have throughout, we have said all of our healthcare partners, including our substance use treatment disorder clinics, any of our mental health services provider, they're prepared. They can coexist with COVID-19. They know how to manage it in the context of the service they are providing. But once again, part of it is as people get behind doors, as they get into their worlds and kind of don't venture out, is to reach out. And if you have a neighbor or a friend, make that referral, make that connection. Part of today is not only the recognition and awareness that individuals have died, but the importance of removing the stigma, recognizing drug addiction as a healthcare consideration and concern. It is not a character flaw. It is a disease that we need to treat like any other healthcare disorder, and we need to make sure that people are aware of that and know the resources that they can reach out to.
Just to confirm, did you say there were 130 overdose deaths last year in Winnebago County?
That was 2019
117 so far this year?
through July 31st.
Through July 31st.
And then, I just wanted to also ask about the opioid task force and what they've accomplished.
Sure, the opioid, and we renamed it as the opioid response team. And right before we went into the shutdown, the question was, what has the opioid response team or task force been doing, what they've accomplished, and what have they been, I'm going to lead it into the next question, what have they been working on recently? So right before we began, there's, as you know, several working groups that work on this. We have a group that's dedicated to safer prescribing and dispensing, and all of our health system partners came together right before to release our opioid prescribing guidelines so that in our community we had established a standard. They have continued to work that throughout the pandemic. We have also continued training, I'm going to say, through the rescue team, which is the naloxone Narcan community-based training. Despite the pandemic, did curbside pickup and would do remote training via Zoom and Skype or whatever methodology people needed so that we could train individuals and then dispense naloxone and Narcan. We supported groups in putting together recommendations about how could treatment be provided. Many of the support kinds of what we call peer-based counseling and support, like NA, Narcotics Anonymous, or AA. Part of that was they're used to group meetings and providing support to each other. And so being able to pull that together in ways that were safe, that would protect the participants from the COVID, while at the same time making sure that they were engaged in the treatment process. The group is continuing to work on what we call alternatives to opioids, ALTO, recognizing that we have a significant portion of our population that continues to experience pain. And how do we best manage pain in a way that reduces our reliance on opioids throughout our community? So that group has continued to work and develop some of that moving forward. Again, I'm going to be honest, the pandemic slowed us down, but it didn't stop us. And so the groups have reconvened and started reinvigorating as well. The justice-involved population has been working on how do we bring more treatment behind the walls. So things like what we call medication-assisted therapy, or MAT, to provide that behind the walls. There's been a team throughout this been looking at how do we expand Vivitrol's more common injection, but also the Suboxone and long-acting, some of the other medications that we can use to help support treatment in the corrections facility. Because again, we knew our highest death rate the last time we analyzed this data in 2018 in a kind of a deep dive. We recognized the highest risks were among those recently incarcerated as they return to the community. So how do we make sure that we provide treatment in the facility and then transition them out in the community with support and care?
Dr. Martell, you're talking about Winnebago County being in the orange for one particular category. We talked about that at our last conference here. And now probably moving into, as you say, for another category. What's the last time that our positivity rate was kind of approaching that 8% number?
So if you look, and I will have to get the exact date, right. If you look at our weekly report that gets out on the weekly now, we show where that graph was at our highest and when you look at the end of April, beginning of May, we were up at around 17%. We gradually declined, but it's been a couple of months at least, and so I can get that for you and we can show you on that graph where that's located. But again, I think part of the discussion about if we want our small businesses back in, if we want people to be able to get back into some in-person education, to be able to return to their work, we need to make sure that people are practicing all these items that we've been talking about. And I wish we had a better way to say it. I wish it was more interesting and fun, but to wear the face coverings, maintain social distancing, washing hands. and especially important as we look at Labor Day, protecting our workforce, our bus drivers, our transportation workers, our healthcare workers, our grocery store clerks, our hardware department store individuals, all the individuals that work and that we rely on to help us, our service industry providers that come into our home to maintain. You get a small loan to help you with their house repair, making sure that those individuals, our laborers, are protected. You know, we've talked about this before. You may not believe that you need the mask because you're healthy. What's the risk to you? 96% recovery rate. You just can't predict if you might be in that 4%. What are the ones, yes, you know, the concerns. So we protect others and we respect others by doing those things that we need to do.
You mentioned some pushback from some people about masks, and there's another update from the CDC that came out over the weekend saying that a large majority of people that died from COVID-19 also had pre-existing conditions. I believe 94%, if I remember that number correctly. I think a lot of people's initial reaction to seeing that is that COVID isn't as perhaps deadly as they originally thought it or heard it. Can you give some context to that data perhaps as to how we should be interpreting that new information from the CDC?
Well, I also want to come back to, we're talking today about reducing the stigma associated with overdose deaths. Let's reduce the stigma associated with having a chronic health condition and then dying of COVID. Again, these individuals did not intentionally want to get infected. Their death may have resulted prematurely from their conditions. And while we know that the advanced age may be an independent factor in and of itself, I come back to the issue of I can't tell which one of a person with diabetes or hypertension or obesity as a single morbidity factor is going to suffer from the death at a higher rate. And so I come back to it. Let's stop the rhetoric around masking and it's not as bad as it could have been or would have been. Let's wear our face coverings because we don't know which one of us has a comorbidity that might create an increased risk for death. We don't, in this country, we don't display it. And so again, we have great treatment options for management of cardiovascular disease and hypertension and diabetes. And so why should we be then putting ourselves at increased risk from COVID-19?
Why do you think that in Winnebago County, you mentioned that our numbers, especially custody rate, was hovering right around that 4% mark for the better part of, if I remember right, at least a month and a half, if not 2 months. Why are we seeing that number start to rise back up here, even before we get to a holiday season?
And the question is, why do I think the numbers are increasing, right? We have not had one single particular outbreak that we would say, wow, we could just put it all together. People are getting out more. Let's face it, we're tired of being inside in quarantine. We're getting out more, whether it's to vacation, whether it's to return children to colleges and other locations, whether it is at an event, a larger event that we want to go to and again, making those intentional choices, but understanding that there's a risk with those choices. The larger the gathering, the more individuals that come from outside a region, potential exposures, where you can't maintain your 6 feet of social distancing, where you don't feel the need to wear your face coverings. All of those put it at increased risk. So I call it the collective response. It would be easy to say if we had one place that would say, oh boy, everybody was there, that's it, and we could safely say don't go there or don't do that. Unfortunately, it's a combination of factors. And once again, we don't want to judge people. I want to be clear about that, the importance of when your contact tracer calls, it's to really find out who else may have been exposed and what we can do. It's not to judge you that maybe you went someplace that maybe was a little higher risk and you didn't take all the precautions you should have. The goal is to help prevent the transmission. So we need everyone to participate, especially as we have to move more indoors as our weather starts to change. It's going to get a little cooler, it's going to get colder. We can't stay outside as much as we'd like to stay outside. And as we begin to bring smaller groups together for our schools and our workplaces.
You mentioned that we're going to be looking at 2 categories in the orange. Is there a certain step, or how close are we potentially to seeing some of those tiered strategies of mitigation factors for us, especially as we move even further into the orange?
Well, and I think, our discussion last week, the question was, as we see these numbers decline or worsen, or increase and worsen in some of the parameters, What mitigation strategies? Well, you saw very proactive strategies being taken by the state as well on counties. So whether there was a reduction in limiting capacity in a particular business or footprint, or it's reducing hours, or putting everything so that there's only curbside or outdoor, those are the kinds of things we need to take a look at. And so I really, it's kind of, we're in a home stretch here where we can, protect our small businesses, our, restaurants, even our bars, who may, again, if we want those to stay open, if we want to be able to shop at all hours, if we want to be able to have more than, 10 people in a particular given footprint, we need to help them. And the way that we do that is by following the rules, whether or not they have a sign up, whether or not someone tells us, oh, don't go in there without that. I come into this, we're not going to police our way out, but if we collectively take the right action, we could help mitigate the infection rates.
If we continue down this road, how close are we as a county before we start seeing some of those mitigation strategies, or a region, I guess?
If our positivity rate continues to climb and maintain at that high rate, I can tell you that would be a growing concern, and we need to then begin to take a look at strategies that help us reduce that. And ideally, it would be targeted at particular events or locations that may have a higher rate of infection, but we're not seeing that. So this is the weekend, folks. You really need to push hard. I hear all the time, we've got, I'm going to say, informal family gatherings that are large in, space. Just because you're family and your family's coming from all over doesn't mean that you necessarily aren't going to be exposed. Put your face coverings on. You can still have a family reunion, social distance, face coverings on. Make sure you space everybody out at the tables that you're going to eat your food at. The idea being, how can we make sure that we protect our community and still be able to move forward and enjoy some of those things that we've been missing as part of a quarantine and pandemic.
Can I add a statement about the opioid? I just want to go back. You had a good question about opioids and some of the responses that have been taking place with that. Just a couple of quick things. One is at City Hall and at our police stations, if you have drugs at home, you can come and drop those drugs off at our drop boxes. It is a huge, I would say, entree into the opioid epidemic is people taking pills from someone's home, their grandparents, their uncles or aunts, their parents' home. And so please feel free to drop those off at City Hall, at all 3 police stations. Last year we had hundreds of pounds that we were able to incinerate. Second thing is our fire department has been working hard to go out. If you are an individual that experienced an overdose, we are going out and trying to proactively, or reactively, I should say, go out to your home and meet with you, provide you education and training. We've partnered with the Winnebago County Health Department as well as others for that Narcan, so that we can provide training on Narcan to that individual and those family members in the home, but also provide resources for treatment. This year has been far more difficult, obviously, with the pandemic to go into folks' homes, but we've still had the ability to go into more than 40 unique individuals' homes. Obviously, that's down from years past, but still really tremendous work done by our fire department to get out there and provide that education, that resource availability in our community. So just want to bring that up.
Dr. Martell, last question I have on my end. I know I asked you at the last press conference we had how our schools are looking at in regards to COVID-19. I know that you mentioned there are a bunch of appropriate channels you have to go through before sharing some information with us, but what's the landscape of our schools look like right now? We are now about a week and a half into a lot of schools in the area opening. Obviously, RPS gets moved back, but we've seen some schools open for some time. How are we looking there right now?
The question was, how are we looking after we've been about a week and a half into some of our schools being opened? And at this particular time, we've not had to close down any particular one class, one school, but there have been what I call context to cases, and then making appropriate, strategies and modifications. And again, we've gone through some of this discussion of contact to contact is important, but in a communicable disease investigation. So oftentimes we've been fortunate to have one removed. We've worked with our university partners who have had cases and taken the appropriate necessary steps to quarantine things like roommates and those people they drive to particular locations with. But we expect to see, and I want the public to understand this, we expect to see cases in the schools as we bring them together. What we don't want to see is a widespread transmission of the disease throughout that school. So we're very tight on cohorting, and so people and parents, I've relied on you. We'll do a great job in the schools, but please do a great job at home. This is not the time to have extended birthday parties and camp, have friends over that normally are not part of your typical group that you play with. Keep those groups small and intentional because the teachers are having to do that as they prepare to open up. And as we know, all of our schools have been able to offer a remote option and an in-person option. And again, recognizing that even if you have the in-person option, if there's a need and your child is quarantined, that you may then slip into the remote for a while and then come back out of that 2 weeks back into your in-person. So we understand, and so that makes another reason why it's so important for us to protect our workers and our community and our businesses also as well. They need to understand that some of their workers, not by their own, may have to stay home to care for a child who's being quarantined because of an exposure in the school. But our goal, as everyone stands here, as you're all out there, is to keep that transmission low.
You mentioned last week as well that there was more concern with staff members contracting COVID-19 students. Is that still the case as we stand here a few days later?
That still has been the case. The question is, has it been staff or student? And at the present time, it's staff. And again, I want to be clear, nobody intentionally exposes themselves to COVID. And so be clear that these are experiences and exposures that they, we're certainly not planning to have. And so do not judge, do not make any assumptions about what they were doing or not doing. And if you've not been notified, then do not, concern yourself because we do an interview with every single one of them to identify who they've been in contact with and determine the risk for those individuals.
Do we know a total of positive COVID-19 cases in schools that are open in the Rockford area, Winnebago County right now?
I do, and I can get that to you, but again, I come back to the fact we are not releasing that until it's a location of concern where there's more than one case in that particular district or that school.
So that means at this point there is no more than one case at any particular school?
That is correct. All right, thank you.
You said there was.
Well, I gotta go to city council too, in case I don't know what you want. I hope you don't bring this attitude to city council.